Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Today I'm going to talk about a very important topic as far as the ENT is concerned. Inflammatory conditions of larynx. Now, starting the inflammatory conditions of larynx, first of all, we talk about acute laryngitis, and among the topic, acute laryngitis can be infectious or non-infectious. And among the infections, one can get it from the upper respiratory tract infections, or it could be from due to bacteria like Streptococcus pneumonia or H. influenza or hemolytic streptococci or staphylococcus. Non-infectious causes of acute laryngitis can be due to vocal abuse, an allergy, or thermal injuries or chemical burns, and so on. Of acute laryngitis are concerned, one can get hoarseness of voice or discomfort or pain in the throat after talking, and dry, irritating cough, which could be worse at night, and general symptoms like fever, headache, malaise, weakness, head cold, rawness or dryness in the throat, malaise, and so on. While the signs of acute laryngitis can be erythema and edema of epiglottis, aryepiglottic folds, arytenoids, ventricular bends, vocal cords, findings in acute laryngitis can be hyperemia and swelling of the vocal cords. Vocal cords can be red and swollen. Subglottic region is also involved in it, and there could be sticky secretions between the vocal cords and interarytenoid area. Now, talking about vocal abuse, it's abnormal use of voice. It's called vocal abuse, such as shouting, preaching, and pop singing. These high pitch and at a high volume, they can get all these problems, like they can get problems with the voice, hoarseness of voice, croaky voice. But the treatment of vocal abuse can be with vocal rest, avoidance of smoking and alcohol, stimulations, cough sedatives, antibiotics, analgesics, and steroids. Now, acute membranous laryngitis is something to know about because this is an important topic, and among this, diphtheria, which is still common all over the world, secondary to fossil diphtheria, and it occurs in children below the age of 10 years. Now, pathology of laryngeal diphtheria is pseudomembrane formation, and it causes obstruction of larynx and breathing problems and suffocation. And the problem with diphtheria is that the organism itself secretes exotoxins, which can cause myocarditis and can cause neurological symptoms and nephrological symptoms as well. Now, here is a picture of Bullneck cervical lymphadenopathy, which shows from laryngeal or pharyngeal diphtheria, along with a Bullneck due to the lymphadenopathy in the neck. Treatment of diphtheria, you must learn about, and that is the most important thing to give in diphtheria is diphtheria antitoxin, which can be, the dose can vary from 20,000 units up to 100,000 international units of diphtheria antitoxin. And antibiotics also given to the patients, which can be in the form of benzyl penicillin, 500,000 units intramuscular for. It can also be, if the patient is allergic to penicillin, one can give erythromycin. Apart from that, one has to maintain the airway, and one can maintain the airway by doing endotracheal intubation, or one can have to do the tracheostomy for securing the airway. Talking about acute epiglottitis, it is another kind of acute inflammation of the larynx. Acute epiglottitis or supraglottic laryngitis, as the name suggests, the inflammation falls on the epiglottis in this kind of infection, and there's inflammation of supraglottic structures, which involves not only the epiglottis, but epiglottic folds and arytenoid cartilages, and there is a marked edema, and there's the obstruction of the larynx. Etiology of acute epiglottitis is that it occurs usually in children between 2 to 7 years of age, and it is the organism causing it is usually Haemophilus influenza type B. Symptoms of epiglottitis: there's abrupt onset of fever with rapid progression, there's sore throat and dysphagia in adults, there is stridor and dyspnea in children, and there's fever due to septicemia. Signs of acute epiglottitis: when we depress the tongue with the tongue depressor, one can see edematous red and swollen epiglottis, and on indirect laryngoscopy, one can see edema and congestion of supraglottic structures. Laryngoscopy in these cases not done for fear of precipitating complete obstruction. Here is an X-ray of the particular thumb sign on X-ray lateral view of neck. Here, it shows the epiglottis like a thumb. That's why it's called the thumb sign. Excuse me. Now, treatment of acute epiglottitis is again hospitalization, which is a must, because laryngeal obstruction can occur anytime in this type of patient. So hospitalization is necessary, along with high dose intravenous antibiotics like ampicillin or third generation cephalosporins intramuscular or IV. We also give steroids to these patients in order to reduce the edema and to prevent airway obstruction. We give hydrocortisone or dexamethasone intramuscular or IV to reduce the edema. And there must be adequate hydration along with humidification and oxygenation of the patient. And one can do endotracheal intubation. If that is not available or possible, one has to do sometimes an emergency tracheostomy in these cases. Now, acute laryngotracheobronchitis is an inflammation of larynx, trachea, and bronchi. That's why it's called acute laryngotracheobronchitis. It occurs more in males than females, and between the age of 6 months to 3 years in children. The causative organism is parainfluenza type of virus, which is 1 and type 2, and it is secondary to bacterial infection may occur in this kind of infection, which is usually viral, but secondary bacterial infection may also occur due to gram-positive cocci. Symptomatology of acute laryngotracheobronchitis: there's upper respiratory tract infection, there's hoarseness of voice, croupy cough, fever between 39 and 40 degrees Celsius, and difficulty in breathing. There is inspiratory type of stridor and supraesternal and intercostal recession. Treatment, again, for acute laryngotracheobronchitis is hospitalization. And along with that, one gives antibiotics, which is in the form of ampicillin, 50 milligram per kilogram per day. And humidification is essential to liquefy the secretions, parenteral fluids, steroids, hydrocortisone, 100 milligram IV 4 times daily, sometimes adrenaline to reduce the dyspnea, and intubation or tracheostomy. Now, talking about other types of laryngitis, there can be chronic laryngitis in this, or there can be without hyperplasia and with hyperplasia. This type of laryngitis can also occur and cause problems with breathing. Now, chronic hypertrophic laryngitis can also occur, which may present as either diffuse and symmetrical type of inflammation of the vocal cords, or it can be localized like a tumor, or it can be in the form of dysphonia plicoventricularis, or in the form of vocal nodules, or in the form of vocal cord polyps, or Reinke's edema, or contact ulcers. These are all forms of chronic hypertrophic laryngitis that give rise to hoarseness of voice. Remember, our topic is hoarseness of voice. Now, etiology of chronic laryngitis is the same, but there can be hyperemia, edema, and cellular infiltration of submucosa. Now, epithelial changes can occur in chronic type of laryngitis, giving rise to pseudostratified squamous epithelium, or hypertrophy, or keratinization. The symptoms of chronic laryngitis can be hoarseness, altered vocal quality, pitch, loudness, or vocal effort that impairs communication or reduces voices-related quality of life. Hoarseness is a symptom, while dysphonia is a diagnosis. Now, easily gets patient in these kind of infections, easily get tired, patient becomes aphonic by the end of the day, and constant hawking and trying to clear the throat, and dryness and intermittent trickling, repeated clearing of throat, and discomfort in throat. There can be dry and irritating cough. Treatment of chronic laryngitis can be same as for chronic laryngitis without hyperplasia, but in the form of surgery, one sometimes has to do stripping of vocal cords. Removal of the hyperplastic and edematous mucosa may be done in selected cases. With damage to underlying vocal ligament should be carefully avoided, and one cord is treated at a time. Now, chronic specific type of laryngitis can be in the form of bacterial infections or fungal infections. And among those, one can remember tuberculosis, among the bacterial ones, leprosy and syphilis. Whereas fungal infections of the larynx can be blastomycosis, histoplasmosis, and candidiasis. Thank you very much.